All right. Thank you. Okay. Perfect. So hi everyone. Let me introduce myself. I'm Gwenaelle Fleury. I work for the ANS that I will present to you just after that. And I work with Charles on the French project and on the European level in the MCWG group, in the XTHR, and in the cross-border group for imaging. So today we will see those points. First of all, a presentation of the agency that I work with, then what we do on point 2 and 3, and then we will dive into the DRIM-M project, which is a project of sharing images in France. So, the ANS, it's Agence du Numérique en Santé, so the French e-health agency. It was created in 2009, and it works towards the goal of promoting the development of shared information systems by doing regulation on sharing standards, by doing some operation work, conceiving major national programs to found and to ask the vendor to do great information systems and a coherent one. And then it works through promotion of initiatives and support of vendors. What it does is, in part, creating the CISIS, which is a framework, interoperability framework with specification around use cases that have a national scope. It's constituted of 3 layers. The professional one that answers professional needs with content and concept. The service layers that specifies the data exchange to answer those needs. And the transport layer, which is soft call to specify the transport of informations. And for each of these parts, there can be functional specification, technical specification, or study of profiles and standards that already existed that can answer the use case. And finally, we work with the Ségur program. This is a program that has been existing for the last few years and that works towards enabling citizens to take charge of their own health. How does it do that? There was a national repository that didn't work for a few years because nobody sent documents to this national repository. So the national agency started the program with an historic funding, an investment of 2 billion euros for to instant the vendors to work with this national repository to send those documents and for patients to have access to those document reports, lab analysis, imaging reports, which is what I will explain. And so the program wants to accelerate the digital transformation roadmap and to improve the information sharing for healthcare professionals and patients. You can have more information on the website that are linked below. I think you will have access to the slides. And one part of this program, the Ségur program, is the DRIM-M project. So the DRIM-M project wants to be able to distribute medical images produced by the 1,000, maybe more packs nationwide. It wants to have a centralized registry and repository, which is the DMP, so the repository that existed long ago and is just starting having some documents. So we are in the infrastructure A that you just presented before. And the national agency created a specification for the gateway, which is called DRIM-Box. And is either managed by the packs or independently in front of the packs. It's an entire software that can be created by vendors. And it has three main functions. A function source, which provides the cost document, the manifest, to the national repository when an image is created. Function consumer, which can search for those manifests in the national repository and then can request access to the images. And a third function, which is a viewer, which answers the needs to how we can have access to these images if we don't have a workstation in our head. And so this allows access for professional users and patients. Just so you have this in mind, the timeline of this project is arriving to an end. The publication of all the documentation has been done, and the vendors have known of this project for, I think, 2 years now, and have done the development that are needed. So we will be deploying this project, I think, this year, because everyone is ready. And this answers two use cases. The one for imaging specialists, which have the infrastructure to view images on their information system. So in this case, on the left, the information system is able to search the national repository for the manifest with the metadata associated, and then ask the national DRIM-M network, which are constituted of a lot of DRIM boxes, the gateway. It asks the gateways for the access to the images that can be viewed on the workstation of the professional. On the right side, we have the use case for general practitioners and patients, which don't have access to a workstation. And they can both have access to the imaging report on the national repository with the professional access and with the patient access. And I didn't see there was a transition, but there is a URL on the report. This is what was presented by Charles before. And by clicking on this URL, you can have access to the images via a web viewer that is managed by the DRIM-Box, so the gateway. To go in further detail, okay, I didn't see there was transitions. Let me just go to the end. All right. So this is the first use case for the imaging specialist, which once again have an infrastructure on their side to see images. So what is done is there is a gateway, a DRIM-Box on each side of the transaction, so on the source side and on the consumer side. On the source side, the information system creates a report, sends it to the national repository, that's the first step, and then sends it to the DRIM-Box. And the DRIM-Box creates the manifest cost associated by getting information from the packs and getting information from the report to create all the information necessary, and then send the manifest cost to the national repository. That's step 2. On the third step, on the consumer side, the professionals that need access to the image can search the national repository with metadata that are specific. I'm talking anatomical region and modality, among others. And once the DRIM-Box gets the manifest, it has the information to call a request to the source DRIM-Box and get access to the images. The source DRIM-Box, that's a step 5, can get the images from the packs and can send them to the consumer DRIM-Box that can now export the images to the packs of the consumer. So that's the workflow for the professional that has a pack system. The small difference for the general practitioner and patients, okay, that's weird, is that they don't have access to a workstation or a PACS. So the first three steps are the same, but on the fourth one, the patient or physician can, as I said, click on the URL, which can lead directly to the viewer of the DRIM-Box source that still calls for the images on the pack source, but shows them on a website directly accessible to anyone that doesn't have a PACS or workstation.
The cost on the consumer side is a mistake.
Yeah, exactly. That's the transition that gone wrong, but yeah, it's only the report. I didn't mention, I don't know if it will speak to you, but I didn't mention the transaction that are listed on each step. So RAD 68 and ITI 41 to send information to the national repository. Then we have ITI 18 to request the information, and ITI 43 to request the document, retrieve the document. And the RAD 107 to, it's a WAD-WRS retrieve to get the images. And the only thing changing on this use case is that to get the images, the patient uses the patient or general practitioner gets RAD 106, which is invoke image display. So it's used only for accessing the image directly. Okay. So the French agency did a lot of documentation on this project. There is two separate kind of documentation. The CISIS specification, which are in part of the framework, the national framework for this use case, and divided in 3 layers that I presented before. And there is the Ségur specification. So that's entirely part of the Ségur program. The vendors, to get the funding that they can have by doing the gateway, the DRIM-Box, they have to follow the specific specification that we created on the DRIM-Box, so the gateway, and the viewer. So just to get into detail on the CISIS specification, so we divided the specification on the managing of the report in CDA. So we have the structuration of CDA in the professional layer, we have the transport of a CDA file on the service layer, and the API REST on the transport layer. And then we also did a specification on the cost manifest and on the access to medical imaging, which are on the professional and on the service layer. So just to get back to the MCWG work, We took the survey that was presented before, and I think we had 70% alignment on the recommendation with this work. And just so it works, we created the DRIM-M network, which is a lot of DRIM-Box in the country, at least as much as the number of packs. So we have to have a trusted space for those DRIM-Box. And this trusted space contains a registry of DRIM-Box and a whitelist. The agency provides the URLs that will be specific to each DRIM-Box and then list them in this whitelist. And each DRIM-Box has to read this whitelist every time they are called by another DRIM-Box to make sure that those are on the trusted space. And there is a DRIM-Box status service which can inform the other DRIM-Boxes on the operational status of the different DRIM-Box in the country. And I think that's it. Do you have any questions for me? Yeah.
Question. When you click on the URL,
Yeah.
how long does it take to retrieve that image of the report? Just an average time.
We don't have an average time because it's not deployed yet, but we have some performance requirements in the specification for it to be quite quick. We have some recommendation on the lossless and lossy part of the images for it to be quick, and
There is no certain time, like 30 seconds, 1 second.
I don't have them in mind, but yes, but Charles, I think, did a work on that.
It's 20 seconds on a 200 megabyte CT scan
Okay, that's good.
from beginning to end.
I'm trying to compare with the VNA.
Mm-hmm.
When you have a VNA on
Yeah.
offline outbound, no, that's good time. That's very good.
Yeah, we'll see if it works, but I think, yeah, the requirements are good on that.
So the way the performance is measured on the DRIM-Box plus the responding system,
Okay.
when it is deployed and it's measured with high bandwidth internet, 1 gigabyte, all of that. When people deploy based on the internet bandwidth that are deployed, both in the hospital and connected to the local network, you may get a little bit less. So the goal at this point was to make sure the implementation of the product were able to meet that performance. The performance that is going to be observed once installed becomes the responsibility of the user. And the thing that Gwenaelle explained very detailed is the way an existing PAX risk gets connected is by the customer places an order for a compliant PAX or a compliant DRIM-Box with the vendor. The vendor takes this order back to the government and get paid in part when it is beginning to be installed, paid another part when it is running, and pay the last part after 6 years.
Oh,
Because it is a 6 years commitment.
really?
Yeah.
And and there is some measurement statistic that has to be done in those 6 years to ensure that the softwares are sending the documentation to the national repository and that the software are functional in asking and receiving images.
So the idea is that the users have no money to put on the table. They are, if they take the initiative to order a system, a compliance system that has been tested per the spec within a year and a half. So it's going to open officially, let's say, in February, as an example. There is 18 months after February 2025 to order a system from your preferred vendor. After those 18 months, you get nothing. But what the government said they will do, they will put a mandate for you to buy it. Okay? So it's paid for the first 18 months. And the purpose here is to get everybody to rush, which the vendors like, because they build something new and that gives them a sizable market on which to compete. The government doesn't select any specific vendor, but any product that is compliant and has been tested is good, and the vendor is on the hook for 6 years.
And also the health professionals have a direct view of how it's working, because if there is only one DRIM box on the nation, it won't work because you won't have nothing to produce or get. So having as much as possible DRIM boxes live in a year and a half, which will allow professionals to get the results directly.
So normally the first order should be placed sometime early 2025. The date is being tweaked. And the assumption is that within 2 years, there is close to 1,000 packs that should be connected. And in parallel, there is a similar program on the wrist with compatible specification to make sure that the imaging report are being published at the same time as the imaging manifest.
Yeah.
And the user is being told, make sure you do the wrist and the packs, and you don't do the packs without the wrist. Silly, but that's one of the requirements.
Is there any more questions?
Who manages the DRIM box infrastructure? I guess because there can be so many, so he has to make sure.
So each vendor has his own software that follow the specification that we gives them, and the agency is responsible for the network, so the security of each exchange and the whitelist, everything that has to do with security or the trusted space is managed by the agency.
So I guess once it's up and running, you'll soon be able to get some real performance measurements and usage and all this kind of stuff. Yeah. It would be great to have that centralized, I guess, so that you can really get a national.
So the operational thing is done by vendors. There is, expected to be around 10 vendors that offer interfaces. So each one of the 10 vendors will have to manage and report on the operation of its system and the response and so forth. There is a little bit of something that has been put on top, which is called a weather report, that basically give you the status of all of the DRIM boxes if they are up and running.
And if they are not for a long time, they can ask for the money that goes with it. So they have to be up, they have to be exchanging information. There are statistics on measurements on the number of images exchanged, on the number of documents pushed, to ensure that everyone is cooperating.
So lightweight oversight by the government, heavyweight oversight when it comes to paying.
Okay. Thank you.